First, the deoxygenated blood goes to the superior vena cava and it goes down to the right atrium, following through the tricuspid valve to the right ventricle. Once the blood reaches the right ventricle, it travels up through the pulmonic valve. Lastly, the blood reaches the pulmonary artery and exits out the lungs. Now the oxygenated blood comes in through the pulmonary veins, traveling to the left atrium through the mitral valve and down to the left ventricle. From the left ventricle, the blood travels up the semilunar valve to the aortic valve and out through the aorta to oxygenate the rest of the body. Are the superior vena cava, the right atrium, the tricuspid valve, the left atrium, and the pulmonary artery.
Resting heart rate. To find resting heart rate, have the person sit comfortably for a few minutes. Then place your stethoscope on the left side of the chest. Count the numbers of beats you feel in 50 seconds and multiply by 4 to get your beats per minute. Now, before I continue, what do you think is a normal resting heart rate? Well, a normal resting heart rate for adults is between 60 and 100 beats per minute. Blood pressure. First, position the person by having them sit with their arm relaxed. Then, place the cuff around the upper arm. Place the stethoscope on the brachial artery. Pump the cuff to around 30 mmHg and slowly release. The first time you hear as air deflates is the systolic pressure, and normal range is 90 to 120 mmHg. When thumping stops, that's the diastolic pressure, and normal range is 60 through 80 mmHg. A reading of 120 and 80 mmHg is ideal. Systolic pressure is the top number in a blood pressure reading, showing the pressure in arteries when the heart beats. Diastolic pressure is the bottom number, showing pressure when the heart rests between beats.
This video shows the heart that we dissected in class. The blue string represents the pathway of deoxygenated blood, and the red string represents the pathway of oxygenated blood.
Aortic septal defect. An aortic septal defect is a hole in the wall septum that separates the heart's two chambers. What do you think it will happen if the two different bloods mix together? When blood is mixed, it increases the blood volume in the right atrium and ventricle, causing reduced oxygen, heart enlargement, increasing risk of pulmonary hypertension, arrhythmia, and stroke risk. If oxygenated and deoxygenated blood mixes in the atrium, the heart has to work harder to deliver oxygen to the body, and the blood's ability to carry oxygen decreases.